So I always tell my patients that they're going to be in the office for about 2 hours. The surgery itself takes an hour, but because my patients are awake and we're doing this under local, we're not trying to rush them along. So it's a kind of a measured, like they come in, they get their photos. I don't take photos at their initial consult just because it's a lot to take photos. And if you're not going to have the surgery, I don't need photos. So, but that means that when you come in for your actual appointment, we're going to take photos, have you sign the consents. We'll put topical numbing cream on. That numbing cream is really strong. And because that area is mucosa, it takes to the numbing cream really well. You can take an oral sedative. We offer that. You just need to ride home if you do that. So, most of my patients actually don't take the sedative because if you're not nervous about the procedure, if you're pretty confident you're not gonna have pain or you think you have a high pain tolerance, then you're gonna be fine because none of this is gonna hurt. It's just more about being nervous about what the procedure is gonna entail. So those patients will take an oral sedative, and then after the numbing has been in place for a while, what I do is I wipe it off, I do the markings, and then I show the patient what the markings look like. And then once the markings are confirmed, then I inject the actual local anesthetic. But because the topical works so well, there's you don't feel the numbing going in. And then once you're numb, then we do the procedure. So it's myself and Bree, my scrub tech in the room, and my patients do a variety of things while we're doing the procedure. So they will chit chat with us. They can be on their phones. They can listen to a podcast. They can watch Love Island on their phone if they want to. A lot of them are watching Love Island right now. But we usually talk about, because the new season's out, we usually end up talking about like current events in like pop culture and like chit chat. So it's the patients who take a sedative sometimes take a nap, honestly, but it's pretty entertaining the conversations we have. That's part of the fun.